Okay, so today let's talk about the muscles of the thigh. The muscles of the thigh, they can be divided into three compartments: the anterior, the medial and the posterior compartments, and they are divided by the intermuscular septum. So the medial septum, it divides the anterior and medial compartment. The posterior septum, it divides the posterior and the medial compartment, and the lateral septum, it divides the posterior and the anterior compartment. Now let's talk about the individual compartments. So anterior compartment, which is also known as the extensor compartment, it is called extensor compartment because the collective function of this compartment is to extend the leg at the knee joint. The individual muscles, they have different functions as well, but overall they function to extend the leg at the knee joint. The muscles are sartorius muscle. So this is the sartorius muscle, quadriceps femoris muscles, which include 1 rectus and 3 vasti muscles. Rectus femoris, it has 2 heads, the reflected head and the straight head. Vastus lateralis, vastus medialis and vastus intermedius. Now there's a small muscle which is called articularis genu. So articularis genu, it is a small muscle which is located behind the vastus intermedialis, and it is also considered a detached part of the vastus intermedialis. Other 2 muscles are the iliacus and the psoas major. Since they are attached in the upper part of the anterior compartment, they can also be considered a part of the anterior compartment. So the nerve supply of the anterior compartment is the femoral nerve, and the arterial supply is the femoral artery. Now going to the medial compartment, which is also known as the adductor compartment. So it is called the adductor compartment because its main function, overall collective function, is the adduction of the thigh at the hip joint, not the knee joint, but adduction of thigh at the hip joint. Now the muscles in this compartment are the gracilis muscle, the pectineus muscle, the adductor longus, brevis, magnus muscle, and the obturator externus muscle. So this is the obturator externus, this is the obturator externus, this is the adductor magnus, pectineus muscle, the adductor brevis, longus, and gracilis. The nerve supply of this compartment is obturator nerve, and the arterial supply is the profunda femoris artery. Now talking about the posterior compartment, which is also known as the hamstrings. They are collectively known as hamstring. This is also called the flexor compartment. So it is called flexor compartment because the collective function, the main function of this compartment is the flexion of the leg at the knee joint, and they also further extend the thigh at the hip joint, but the main function is flexion of the leg at the knee joint, so they are considered the flexors. The muscles of this compartment, the hamstring muscles, it includes the biceps femoris, semitendinosus, semimembranosus, and hamstring part of the adductor magnus. So adductor magnus is a big muscle, so the hamstring part, it comes under the posterior compartment, and the rest of the remaining part, it comes under the medial compartment. So these are the muscles, and the nerve supply of the posterior compartment is the sciatic nerve, and the arterial supply is the profunda femoris artery. So this was a brief discussion of the muscles of the thigh, and we will discuss in detail about these muscles in some subsequent videos. Thank you for watching. Enjoy.